Welcome, everyone. Thanks for being here. I'm Joy Hogue with Families as Allies, and this is the first of 7 discussions where we want to come together as a community and just look at how can we in Mississippi start developing a community of people who are interested in patient-centered outcomes researches. Um, Patient-centered outcomes research. And what does that even mean? And so we're going to talk a bit about that today, and then start looking at some foundational principles that have been established that help people who want to develop that kind of community, that give them guidance on how to do that. Any thoughts or anything anyone wants to share before we start? Or did anybody have any particular reason why you're here today and we're thinking, I hope that we end up talking about X? All right, let me go ahead and share my screen. And this will just be a brief presentation, and then we'll have some time to share and just think about how this can apply to us. So this is a series, again, based on the Patient-Centered Outcomes Research Institute. And a lot of times people just call that PCORI, and foundational expectations for partnerships and research. And that's a whole lot of words, but we'll go through those just to make sure we're all on the same page. And all of these slides, this information was taken directly from the PCORI website. So it's their information. Any of y'all who have been to that website know that it is extremely dense and there's lots and lots on there. So sometimes it can be a little bit difficult to find what you're looking for. So we wanted to pull out this information about foundational expectations and just have this time where we can all talk and reflect and see how this might apply to us in Mississippi and some exciting opportunities that might come from it. Those of you all who know me know that I love, love, love hyperlinks in slides, so that you will get the copy of these slides. They will be in the blog that will go out. So if you like to dig deep, you can go through and go to all the links and find out more in depth about a lot of these concepts. Or if you just want the information that we're going to talk about today, you can go through the slides without hyperlinking everything. So these are the, just to keep us on track, we had our welcome. We talked and did a little bit of a meet and greet before we started the recording. And so we'll spend a few minutes talking about what is this first foundational expectation that's called representative involvement. We'll look at an example that's already going on out there that PCORI shared on their website. Then we'll spend a little time with our own thoughts and discussing what might that look like in Mississippi. And then we will end by 12:45. We want to stay on time. Okay, so this is what PCORI is. And again, some of these words sound complicated and very scientific. And it is a very scientific research institute, and does very, very excellent work from any perspective, including the scientific rigor. But I think we can break these down in a way, some of these words in a way that starts making sense for all of us and being really meaningful. When this started making sense to me, and that took a little while because I've been looking at PCORI work for about almost 10 years. To me, it was a real game changer when I realized what they're trying to do and made me feel like, as far as the kinds of changes and growth that we might want in our systems, that this is one pathway that could be really, really significant. So PCORI funds, and they are not a government entity, they fund comparative clinical effectiveness research. So that means comparing two treatments of some sort of condition. It could be a mental health condition or any kind of condition. Like today, the example is having to do with diabetes that helps people make informed healthcare decisions. So the people who have the condition, it gives them the information they need to figure out what kind of choices they want to make about their healthcare and their options based on the outcomes that are important to them. And it improves healthcare delivery and outcomes by producing evidence from research guided by patients, their caregivers, and the broader health and healthcare community. So basically, what that boils down to is when medical researchers want to do research, instead of just saying, oh, we think we're going to study this and look at these two approaches to this way of treating this illness, instead of doing that, them starting out by going to the people who have that condition and their families and other people working with them and asking those patients and their families, what kind of outcomes do you want from treatment? That's the real game changer. So it's not about, let's just say it's something about mental illness. It's not about the researcher saying, I think we should do something for, people who might hear voices as part of their mental health condition, and we should get them to stop hearing voices. Instead of doing that, going and asking the people with that condition and saying, what do you want? And they might say, I want to be able to hold down a job. I want to be able to finish school. I can deal with the voices if I get the kind of support I need to do those other things. So it's about basing the outcomes on what people who have the condition want. And that's huge when you really think about it. And then giving them choices and saying, we compared these two things. If we do this or that, and this is what we found, and patients helping with that research all along so they can decide between those two things what matters the most to them. These are, in order to do that, there's got to be some principles to guide how everybody partners together. And these are the principles, and this is what we'll be talking about once a month for the next few months, one of these principles each month. And today we're going to talk about representative involvement. And this is what it means, that any research project about a medical condition should include partners. So that includes patients and their families, organizations, researchers, and other team members who reflect the range of patients and communities affected by the research topic. So it's the whole range of people. It's not just people going, like a researcher going out and finding, oh, these are the patients that seem like they'll cooperate, the ones that seem like they might be easy. Saying, where are the whole range of people? The people who may like what we're doing, the people who might have some questions about it, the people who question everything, maybe the people who don't normally speak up, maybe especially those people. And what can we do to help them feel comfortable and make this project the kind of project where everyone is going to want to give their feedback? So in order to do that, these are some questions that PCORI encourages groups like ours as we develop this group of people in our community who wants to learn to do research in this way to start thinking about. And this is especially important for researchers to think about. How well do the partners and researchers on the team reflect the perspectives and experiences of the groups and communities that the project will benefit? It might be just two researchers saying, hey, we have an idea. That might be a good idea, but that team does not yet reflect the perspectives and experiences of the group it's about. And even if it has some people on it with that condition, it may not be that whole range of people. And it may not be all their families, and different people within that group may have very different perspectives. So that's the first question. What efforts have been made to intentionally include the range of partners and organizations whose perspectives and experiences have not been reflected in the past? So, what's been done? Is it just like a flyer got sent out, a one time event? Maybe somebody went and gave a presentation at a church in a community that might represent people that the project's trying to reach. All of those things could be good, but is that really going to get to the whole range of partners? And this last one is music to our ears at Families as Allies. To what extent does the team, so the research team, include patients with lived experience related to the research topic as partners? So, not just some people who came to a focus group once, but as real partners versus asking researchers or other team members to describe the patient perspective. So, that's where we want to start with this principle of representative involvement. And any time that research is being considered, for everybody to reflect on these. And I think I just left Biz in the waiting room for a little while, but she's getting ready to join us. So this is some from PCORI, some practical steps for how to put that expectation that we just talked about, representative involvement, which means having everybody at the table, how to put that into practice. The first one, and what we just went over alluded to this, is identify the needed perspectives. Who's not at the table? And that includes looking at the whole range of people who are affected by a condition and including them, not just having one or two people and saying, okay, we did that now. If the topic is about diabetes, we went and found two people with diabetes, and we all know this happens. Maybe we went and found two people who we already work with, or someone who works down the hall and saying, doesn't your child have this? And could you come help us? That's not what this is talking about. It's about what really, really thoughtful about who are the people who are not here, including the range of people affected by something. Build relationships with communities of interest. And it was fascinating reading about this because, and again, all this is on the PCORI website and got links at the end. They talked about going into a community like for a year and getting to know a community before ever proposing a research topic and saying, and not going in with, we want to do this, and here's a gift card, so will you do it with us? But going in and saying, we've had thoughts about this, but we know you're the experts. What do you want us to understand? What can we learn from you? And then advancing research partnerships. And what that really implies is recognizing the ways that research partnerships, just by the way they typically are often putting people who have lived experience with the condition and their family in a position where they don't have as much power and don't have as much access to the things that are needed, and recognizing that and saying we want to address those things and make sure we really are doing this in partnership. And what do different people need to be able to partner on this relationship, in this research relationship, and recognizing they haven't had the experience with all these terms and experiences and even the same types of meetings, and what needs to happen to make that feel more comfortable and to work better. And that doesn't imply, giving them a list of vocabulary words and saying, okay, now we're all set to go. It implies things like researchers and people who are more used to doing this work looking and saying, how do I need to be different too? And how might I need to approach things differently? And that gets to creating a welcoming team culture and environment. Like, how do we set things up based on what everyone's saying, especially people with lived experience, is going to make this work better? And it may be those simple things like when we schedule meetings or arranging for child care, some of those things we typically think about, but it goes beyond that. It goes to changing the mindset of people who are typically at the table and the ones typically doing the research, changing the way they interact with the people who have the condition they want to do research about. So that's some of the practical steps for putting this into practice. Okay. Any thoughts about that? And I think we're staying, or let's see if we're still staying on our agenda. Oh, we're 5 minutes. Um, we're running a little bit behind, and I think we'll be fine. But any thoughts about those? And then we'll look at an example that PCORI shared. Okay. This is an example from the PCORI website, and I am going to read a little bit just because it's well written. This is just an example they gave of this in action, representative, everybody being at the table. A practical example from the field. And I just copied the first 2 or 3 paragraphs. So researchers were studying differences in health outcomes across groups, looked at data, and identified a local community that had poor chronic disease outcomes. So that made them think, what do we need to do? What can we do? Because of a history of trauma, so they're not blaming these people, they're recognizing they've been through a lot. This, and I bolded, the bolding is me, things that I thought we might really want to reflect on. This community had a high level of distrust in US healthcare and health research. So they recognized that from the beginning. They didn't blame. It was more, this is a reality. So what do we do? And I thought this was fascinating. See how the next paragraph begins. For more than a year, researchers and community leaders built a relationship with each other. So they spent time in that community. And it doesn't talk about what the researchers did to try to make people trust them. It talks about how they changed themselves. Researchers worked hard to gain an understanding of the community's culture, which centered on the collective, so family cooperation, community respect. Researchers attended events important to the community, so they weren't expecting that community to come to some big day they put on. Not to say that's always a bad idea, but it was about them adapting to that community. To gain a better understanding of community strengths and priorities, researchers and community leaders worked together to conduct surveys, focus groups, and interviews in the language of the community. Community members selected diabetes as the most important issue to study. So they're the ones who picked it. And everybody worked together. And in other places, there was emphasis on, they weren't always thinking, oh, I have to go in and do this as a researcher, but developing partnerships with people in the community who could go in and do the kind of work like with the surveys that researchers typically do. Researchers invited community members with lived experience of diabetes to serve as partners. On an advisory board, researchers shared information about the potential project, asked community partners what they needed to be advisors. So they weren't just saying, yes, we want to be partners, we want to learn from you. They asked them, what do you need for us to be able to do this together? And then provided whatever that support and training was. So this is an example pillar. So I'm going to stop there And I just want you to know we will put, like I said, this will go out in a blog with these slides, and you can register for the rest of this series, and I hope you will. And then also, there's a good overview of all the foundational expectations. So let me just see, make sure that I went over everything. Okay, I'm going to stop that. And again, thank you for being here. Um, I don't see Biz. Okay. But any thoughts about that, or what that might, did it hit you any kind of way or make you think about anything that might be interesting, either with what you personally work on or things that you wish we might see in Mississippi?
Hey, Joy and everyone. This is Dustin. I'm not going to turn my camera on. I'm in a public place, and I'll spare y'all. What I will say is that one of the things that I thought was very interesting in that example that you shared was the fact that it wasn't just an invitation to have um, partners just join a committee or join an advisory and just kind of feel their way through that advising. I really appreciated the example that they said that they asked those members what do they need to effectively be good contributors to that, and like and it was and it seems to have come from an intention to say we want to listen to what you have to say. We know you may need to have some things to fill in the gap, but we want to be in a prepared as researchers, the other team, to know how we want to be able to listen to you, and we want to be able to understand what you're contributing, as opposed to just saying, well, we've got representatives here, and they may or may not contribute that much. So I thought that was a very important thing that I gained from that, from the research side of it, for sure.
Yeah, it sounds very intentional. Do you want to take a minute to introduce yourself, Dustin, since you got on here a little after some of the other people did, just so they know?
Sure,
I
I'll
didn't mean to make you turn on your camera.
Now, just very quickly, since it's recorded, in case anybody watches this that we have not met. But yes, I'm Dustin Sarver, and I'm the executive director for the Center for Advancement of Youth at the University of Mississippi Medical Center, and do a lot of I'm a clinical psychologist and do a lot of research. But one of my hopes is to ensure that research that's done in children and families is patient centered, and we have access to hearing from individuals and families with lived experience, and who are part of the populations we serve, and that conduct research. So I'm coming at it from that perspective, but really value and want this series to be something that informs really myself in terms of what things I can do better on the research side to involve and have relevant questions and outcomes that are pertinent to families and of the utmost importance to them. And so that I've been lovely to work with families as allies for a long while on some clinical service grants, but this is really very interesting, kind of to go into a research type of a project. I'm learning it because this is new to me as well.
Thank you, Dustin. Any other thoughts?
Hey, Joy, as folks have an opportunity to watch the YouTube video or listen to this discussion, if they have questions about, how do I invite people to come join this group, or I'm not sure I'm clear about this or that, who should they get in touch with?
I was going to include the emails for those of us. There is a group of us who have been meeting, and it's Sue, Dustin, me, and Terrence Hibbert, who may be on here in a minute, um, to just, we've been talking about this and thinking about how can we keep bringing people together around this and support anyone who's interested. So I would say they could contact any of us, And then also just by signing up for this series, that would be another way. Because that's, I don't know, what do you think, Sue? Does that sound like that would
Sure.
work?
I think that makes sense.
And then that way, if they have a particular, like a researcher might want to contact Dustin, I don't know, but that way they would have some options. Any other thoughts or anything that makes you think about, or any topics that you wish, like when you think about this approach to research, that you think would be, that you think it would be especially helpful to use it with?
Well, Joy, I think if I'm correct, um, we have not had any opportunity for an award with PCORI in Mississippi before, and so we're starting from zero here and trying to do it, I think, very in the most authentic, with as much integrity as possible. And so we really just want to encourage folks that have a chance to hear this discussion or participate in it to bring others to the table so we can learn from each other.
Absolutely. And I mentioned this at the beginning, we are working on a letter of interest or letter of intent related to looking at how this might look with bringing people together around wraparound care coordination. But that's just one idea. And it's something we're really interested in at Families as Allies and Tara's with the Mississippi Wraparound Institute. So we're hoping they are too, and that families will be, but there's all kinds of ways. Hey, Terrence,
Hello.
I'll put you on the spot. We actually just went through representative involvement and talked about what that is and kind of this whole approach that we're looking at the foundational expectations. Um, I'll let you introduce yourself, and I don't know if you have anything you want to share, not knowing what anybody else said, but you're of course welcome to share. And I did mention you were part of that core group of those of us who've been coming together looking at how can we bring this approach to Mississippi and what does it really mean to develop a community of people that's
Mhm.
focused on patient-centered outcomes research. So whatever you want to share, I'll give you the floor, Terrence.
Well, thank you. Yeah, so sorry I'm late. The My name is Terrence Hibbert, and I work for Canopy Children's Solutions, and I am the director of innovation here. And one of the things that I'm focused on is sort of developing new approaches to understanding what we need and how we can look at things. And so this model that we're looking at, I think, is really, really important. And There's been too many times when we've had research done or things that we've looked at, let alone things that have been rolled out, that haven't had enough leadership from families and communities and that sort of thing. So this is a really strong effort to change that, um, and to have community involvement right up front and community leadership right up front. So very excited about it.
Thank you. Any other thoughts? Well, I'll take the liberty of sharing one thing this made me think about today, just reading through all this. I think, and getting ready for today, I think most everybody who knows me knows that I have a 25-year-old son who has multiple anaphylactic food allergies and has since probably since he was born, but we started figuring it out when he started eating and would not be able to breathe. And I can remember like allergists, and he has a great allergist, but when at that time, the only thing they could say is don't feed him what he's allergic to. And we kind of already knew that. And I thought, you went to school all those years and that's what you got. And I was just thinking back to those days, and it was so hard. But like from a research perspective, and there wasn't I don't think there was a whole lot of research in that area at that time. Um, I think what, but if there had been, I think the allergists would have been researching, how can we make sure families don't feed their child what they're allergic to, or what do we do, or that type of thing. But what I was thinking is, how do we stop him from being allergic? And at that time, they were saying, that's not possible or whatever. And it's been really interesting to watch how that research has evolved. And now they are looking at those types of things. And I don't know that there's ever been a PCORI study on food allergies, but I think that mindset is shifting enough in the research community. And now that is what it's focused on, is how do we keep people from being so allergic, and are there ways to treat this? And I will say, when he was pretty young, he did desensitization, which didn't happen to work for him. So there was that available by the time he was 7 or 8. But and now my son is taking Zolair, which is one of those things that they started looking at, and is able to tolerate incidental exposure to his allergens. So that's just an example. And I thought about what a game changer that is in his life and in my heart. Um, but I think that never would have happened if there hadn't been a shift from what do allergists look and see as important. And that was, let's keep this patient alive and don't let them eat what they're allergic to what are these patients and families saying? And they're saying there needs to be some sort of cure or treatment. So I thought about that while I was working on this. It's very real what people who are actually living with something want. Any other thoughts? Well, I hope everyone will join us next time and continue to come to these. They are the fourth Tuesday of every month for the next 6 months, at noon. It's virtual, and we will end by 12:45 because we know everybody's busy. And we'll just look at one of those principles each month and what it means to us and what that might look like in Mississippi. So please come back next time and bring a friend. And this will go out in a video. It'll be on our website. So anybody who missed this can catch up with us that way. Okay. Thank y'all. And y'all know at Families as Allies, we end all our meetings with go forth and conquer. So y'all go forth and conquer, because working together, there's nothing we can't do for our kids. Bye. Thank y'all for being here.